Administration of antidote. According to the International Program on Chemical Safety definition, antidote given against is a therapeutic substance used to counteract the toxic actions of a specified xenobiotic. The classifications of antidote can be classified into two ways based on the mechanism of action and the site of action. Classification based on the mechanism of action, that is depending upon their mechanism, they are divided into 6 classes. The mechanism of action are given in the toxic bypass effect bypass. Antidote is in this category. Do not interact with the poison at all. They simply bypass their toxic effect. There is 100% oxygen in carbon monoxide poisoning. Inert complexes formation. Next is inert complex formation. Form an inert complex with the poison, rendering it useless. Dicobalt editate for cyanide. Chelating agents for heavy metals. Persian blue for thallium. A specific antibody fragment for a digoxin. Sodium thiosulfate forms an inert complex with the cyanide, sodium thiocyanate. Accelerated detoxification, that is N-acetylcysteine accelerated detoxification of paracetamol. Reduces toxic conversions, reduces toxic conversion to more poisonous metabolites. Ethanol reduces the toxic conversion of methanol into formaldehyde by competing for the same enzyme. Alcohol dehydrogenase. Receptor site blockade. Atropine for OP compounder. Receptor site competition. Naloxone for opiate. A classification based on the site of action, that is antidotes may counter poison when they are within the GAT tract, when they are in blood, when they are acting on the target cells. Classification antidote based on the site of action: mechanical or physical antidote, chemical antidote, chelating agents, serological antidote, physiological or pharmacological antidote. Mechanical or physical antidote. Mechanical or physical antidote are work mechanically on poison with GAT tract. They are classified as adsorbents which are absorb poison on their surface. Activated charcoal. Demulcents prevent their absorption by making a protective covering on a stomach wall. Milk, ghee, oil, butter. Diluents dilute the poison, rendering them ineffective. Plain water, bulky food. Some antidotes may work in more than one way. Example, milk may act as a demulcent and also diluent. Adsorbents. Adsorbents are antidotes which absorb poison onto their surface. Activated charcoal betonate, particularly calcium betonate, which is a major constituent of Fuller's earth multianimity. Fuller's earth was once used by Fuller's workers who clean their clothes, particularly wool, to eliminate oils, dirt, and other impurities. The process is known as fulling. The clinical toxicology, the mainly used for paraquat poisoning. Most important adsorbent is activated charcoal, activated carbon, or activated coal. Medicinal charcoal. It is a form of carbon that has been processed to make it extremely porous and thus have a large surface area available for absorption of poison. It is a fine black odorless powder recognized as long as an effective antidote to poison. Charcoal has been used for medicinal purposes for thousands of years. The Egyptian papyri document the use of charcoal in 1100 BC also. In 1831, a French pharmacist conducted a bold demonstration. After meeting at the French Academy, he ingested several times the lethal dose of strychnine with equal amount of charcoal and survived. It was not until 1968, after the Holt published a review article in the Journal of Pediatrics entitled "The Black Boot," that activated charcoal become more widely accepted in the management of industrial poison preparation. Activated charcoal is prepared by destructive distillation, heating in the absence of air, of carbonaceous substance such as wood, pulp, bone, starch, petroleum, lactose, sucrose, and coconut shell. This process open up millions of tiny pores size between 1 to 100 Nanometer between the carbon atoms increase the surface and enormously. This allows carbon activated charcoal to absorb large quantity of poison on the surface. Superactivated charcoal. A new product market in 1996 had a surface area of about 2,500 and 300 square meter. The absorption occurs by hydrogen bonding and van der Waals force. The poisons are best absorbed in their non-ionized forms. Strongly ionized molecules HCl, HNO3 are not absorbed. Salient features. Activated charcoal is typically given after gastric lavage. It is considered the single best effective antidote available dose. The usual adult dose of 50 to 100 gram mixed in about 250 milliliter water. The pediatric dose is 1 kilogram per kilogram. Drug not will absorb, as well as some contraindications are also there. Drug not absorbed by the activated charcoal is corrosives, acid, alkali, cyanide, lithium, iron. Methanol, metals, but activated charcoal is useful in inorganic mercury, ethanol, ethylene glycol. In all above poison, activated charcoal is not recommended except in cyanide and methanol. Binding to activated charcoal to cyanide is less than 4%. Activated charcoal is very useful antidote in cyanide poison because its toxic dose is very useful. Antidote in cyanide because toxic very smaller. 50 gram of activated charcoal bind more than 10 lethal doses of potassium cyanide. In methanol, activated charcoal is given because it prevents absorption of co-ingested toxins. Activated charcoal is contraindicated in phenols, pesticide, petroleum product, distillate, unprotected airway, hydrocarbon or heavy metal. Iron, ileus, intestine obstruction, acid, alkali, alcohol, altered level of consciousness, aspiration risk, lithium, lack of gag reflexes, solvent, and seizures. Then mechanism of action. Thank you.